Good morning. I think we've got a big crowd out there. I can't see. Pretty bright lights up here. I think I'm good here. Okay. So I'm going to kind of start off this morning with an overture of what the day is going to be. But really, I think that the whole theme for the whole weekend here is kind of brain health and prevention and living well. So today, our focus in this room is going to be Parkinson's disease. So I'm going to be talking about living well with Parkinson's and kind of how to cope and live a fulfilling life. And so I like this idea of living well. It wasn't my idea. Actually, it came up, I think, from our resource center previously. I like the theme of that, living well. So that's what we're going to talk about today to start off. Well, let's try again. There we go. Okay. So Parkinson's disease is a progressive neurodegenerative disorder with no cure. So start off on this kind of down note. So when we make this diagnosis, a lot of times we start with this, and it's not something people want to hear. But, so we have to start with the but. So Parkinson's disease is a progressive disorder. There's not a cure, but we have good treatment, right? So we have good treatments for Parkinson's disease. We have medications, and we've talked about those in these types of talks before. Medications are helpful for the symptoms of Parkinson's disease. We have, good treatments. We have levodopa. We have deep brain stimulation. But the best treatments for Parkinson's disease, the only disease-modifying treatments for Parkinson's disease, the only things that have been shown to slow it down, they start with you as the patient. And so I've got a lot of pictures of some of these things on here. Some of these things are available through our resource center. These are things that you can do on your own, but staying physically active. So the best treatment for Parkinson's disease, and I'll try to be redundant with this today over and over, exercise starts with you. So we see a group of folks with Parkinson's disease doing some Tai Chi. So there's good studies that suggest that Tai Chi helps to slow down progression of Parkinson's. We'll see a rock-steady boxer up there in the corner with a big grin and a glove on. So these things are helpful to keep people physically active. Groups of people with Parkinson's, working towards a similar goal. We'll see some folks doing pedaling for Parkinson's down at the bottom there, again with big smiles on their face, which I think is also helpful to do these things with big smiles. So good treatments, good outcomes with Parkinson's disease start with you as the patient and as the caregiver and the loved one. Good treatment starts with you. So, again, as an overture, today we're going to talk about mental health in Parkinson's disease, and we've got a guest whose talk is going to be all about mental health in Parkinson's disease. Our keynote speaker, Dr. Neotis, has joined us from New York, and is going to talk about some exciting things about Parkinson's prevention and how that's going to look maybe in clinical trials as we learn more about people that maybe have undiagnosable Parkinson's, but what we call prodromal Parkinson's, so before it's ever manifest, and what that looks like in the future. And so that's exciting. And then again, exercise in Parkinson's, and I'll reiterate this a lot through my talk today, and you'll hear that throughout the day, that exercise is so important when it comes to Parkinson's disease. You can see from the American Parkinson's Disease Association, this little pamphlet that I've clipped in there. So they've also used this idea of living well with Parkinson's disease, and they have 10 things you can do. We're going to talk today about some evidence, and I'm going to boil it down to even fewer than 10 things we can kind of remember easily to think, what can I do to live well with Parkinson's disease? So we'll have some evidence-based medicine, right? Not just pop psychology, things that sound nice, but evidence. So you start out, you say, which glass am I going to be, right? Am I the half full or the half empty? So we see a couple of the faces we recognize there, Michael J. Fox and Muhammad Ali, on our half full side, right? What things can you accomplish? How can you be an advocate for yourself and for the Parkinson's community? How can you continue to be productive in your life and in the community? And this classic picture, you've seen it a couple times already. This is actually from the front cover of James Parkinson's manuscript. This is kind of the classic picture of somebody with Parkinson's, and it looks like to me a mope, right? So these are maybe some of the symptoms of Parkinson's, but it just is drawn in a way and it presents in a way like it's black and white, and it's just not vibrant. It's a glass half full. So we want to avoid that. We want to work towards a positive mental attitude. So when we talk about mental health and Parkinson's disease, again, this starts with you as the individual. So to be successful in living well after receiving a diagnosis of Parkinson's disease, one has to start with a positive mental attitude. So you have to get involved. You have to get involved in your life and in your care. And that doesn't mean just with taking medications, but getting involved in your care. Stay active. You can't just kind of resign yourself. Oh, I have Parkinson's disease. It's, this is the end of things. I'm not going to do well. You have to have a positive mental attitude. Stay involved. Get active. Be motivated. Most of all, I think this is really important, and I'm going to, again, provide evidence from scientific research that this is really important. You have to believe that you can live well with Parkinson's disease. If you don't, you won't. We have scientific evidence to back this up. So there's a paper from a journal called Parkinsonism and Related Disorders. And this one stuck out to me. It's several years old, but I recall seeing it. And I had really at the time not really heard of a nocebo response, but it's something that's been studied in Parkinson's. We've probably all heard about a placebo response, right? So when we do large clinical trials, in order to determine whether the drug that we're using is actually effective, it's compared to a placebo, right? A sugar pill, right? Because sometimes you think you're having benefit, or you're thinking you're having side effects, but it's maybe not from the drug itself. And so there's a strong correlation with our belief of what we're doing or receiving and how we actually interpret those results. And it's more than just a belief. There's actually physiologic changes that can affect this. And so this paper showed from a systematic review, meta-analysis of a lot of journal articles looking at this nocebo response, that there's actually changes in the brain. So this is from the introduction of this. And we see that there's actually a change in how dopamine is released in the brain. Right? So we know dopamine is related to Parkinson's and Parkinson's symptoms. When we see loss of dopamine cells related to Parkinson's, there's actually a change in release in dopamine based on a placebo response, meaning people believe they're getting an active ingredient. They actually do get better, and not just believe they get better, but they actually get better. They actually increase their dopaminergic response. The opposite's true too, and particularly when we look at Parkinson's patients in general. So, and this actually can be tough when you're trying to do a clinical trial, because not only you can do a placebo, and you can measure that, but it's hard to measure this nocebo response. So what that is the belief that you are not going to get better, or that you didn't get the active ingredient, because that can have the opposite effect. It can actually make you not improve with a drug that maybe is actually providing some benefit, because it's a negative placebo, basically. So there's evidence that this actually affects it. So if you start with a glass half full and you don't believe that you're going to get better, you won't. And it can physiologically block this from helping. So it is really important as you look at how can I live well, is first start with a belief. Can I live well with Parkinson's disease? And if you believe you can, then you can. If you believe the opposite, it can have the opposite effect. Your beliefs and your mental attitude can directly affect your brain function, right? So if you get told you have Parkinson's disease, or that you probably have Parkinson's disease, or if you find that you maybe have a risk for developing Parkinson's disease, and that's, again, as we talk about prevention of Parkinson's disease, if you already have Parkinson's disease, you can't prevent it, but we want to look to prevent, to slow it down from worsening. And as we're going to find out with maybe some of these other talks today, we are getting closer to finding out how to diagnose Parkinson's in what's called a prodromal stage, and looking for potential genetic risk factors or other physiologic risk factors that may identify people who have an increased risk of developing Parkinson's. And so how can we approach that with a positive mental attitude and improve our outcomes, do better, and live well, right? So if you know you have Parkinson's, or you're going to maybe get Parkinson's disease, but you become a couch potato and you say, oh, I kind of give up, I resign, or everything's kind of gloomy, outcomes won't be great. You won't do better. But if you want to do better and you stay active, you definitely can. Now, these are a couple of local examples some people we've partnered with. And I was looking for more pictures. So we have lots of examples of this in our community. We have, our boxers and our golfers and all the people that are staying active and doing things. And so these are people that are living well with Parkinson's, right? They've taken their treatment in their own hands. They've partnered with their physician, whether that be with medications or with surgeries, but also they've stayed active on their own. They've had positive mental attitudes. They've kept doing things despite having a diagnosis of Parkinson's. So you can't let that get you down. You have to stay on top of it. You have to work on your mental health. You have to find what works for you. We're going to talk about exercise too a little bit in this talk. But one thing I've told patients with that too is, what exercise should I do? Well, there's lots of studies that show this and that, but you have to find out what works for you. What keeps you active? What motivates you? Is it your grandchildren? Is it gardening? Is it a job? What is it? Motivate yourself, stay motivated, stay active. Exercise is important, but just general activity has even been to be found to be important. So there are studies that say forced activity, meaning extra exercise, is helpful for slowing down the disease. But when we look just epidemiologically too at the overall activity, so somebody that's maybe still working and staying active and that sort of thing, is still better outcomes. So staying active in general throughout your life has better outcomes when it comes to Parkinson's disease. So that really has to be the focus when you start. How can I live well with Parkinson's? I have to take care of myself. I have to focus on my wellness, surround myself with a team that's going to help with my wellness. So prevention, again, a conversation's starting. This is a clip from the abstract of a recent publication of a number of articles, kind of an extra publication from the American Academy of Neurology. And you'll notice that Dr. Neotis is the first author on this, and so she's going to be joining us today as the keynote speaker. But this conversation is brewing. How do we prevent Parkinson's? How can we study this in a way where we can get an adequate population and actually learn what kinds of things may be helpful for prevention? So right now we have a lot of epidemiology suggesting, well, maybe people who take ibuprofen or who drink coffee or things like this, maybe it helps prevent or your likelihood of that. But we need evidence, right? So we can't just tell everybody to go take ibuprofen and coffee and then keep the gastroenterologist in business because we have ulcers now. We have to have some evidence, but we know we have some evidence right now. The one thing that can do that, right? So while we're working on other studies and we're looking for things that we have clinical trial evidence to support, we have something, right? So I often think of the parable that you hear like in your church about the guy and it's a flood and he's on his roof and it's like, I sent the canoe and I sent the helicopter and he's like, I'm waiting. You don't have to wait. We have something. We have strong evidence to support this, right? It's just not what people want to hear. They want a pill. I want to take a pill. I want you to cure me. I want to be done with this. I don't want to have this diagnosis. We don't have that option. But we do have treatment, exercise. And I've told patients before, early on, if I see somebody and say, well, we don't know that you have Parkinson's yet. You might. Somebody that's come to see me in the clinic, you might have Parkinson's disease. We don't know. But if you do, it's not bad enough you need a medication to treat your symptoms. And they say, well, what can I do? And I say, well, if you have Parkinson's disease, the one thing we know is exercise slows it down. If you don't have Parkinson's disease, I'm going to recommend you exercise anyway, right? Our doctors have told us our whole life, right? Eat healthy, exercise, right? That's going to be the theme today. It doesn't matter which one of these rooms you go into. Eat healthy, exercise, mental health, take care of yourself, right? We know that that's important for brain health, even if you don't have Parkinson's disease. So, if you have Parkinson's but your partner doesn't, they should be exercising with you anyway because it's important for their health. And it's important in building your team. So exercise, exercise, exercise. Again, another picture of our boxers, which are one of our good promoters of exercise in Parkinson's disease. And again, it's not just something that an apple a day keeps the doctor away. We have evidence, right? So this is Dr. Alskog, who's written a book that many of my patients have read as far as teaming with your doctors for treatment of Parkinson's. And they did a study at the Mayo Clinic specifically looking, does vigorous exercise have a neuroprotective effect in Parkinson's? And the answer is yes. We've had numerous examples of this, right? And that's why, the group in Indianapolis where kind of Rock Steady Boxing came out of it are doing some studies as well to kind of look specifically at Rock Steady. But I have no doubt if you take a group of people and have them not do anything, and you pick any of these exercise programs and you have them stay active, the active group is going to do better. So you can't necessarily study everything, but that should be the motivation. And that's what I'm telling my patients too. So some of my patients, rock steady boxing is too aggressive for them, right? That's not their personality, it's not their lifestyle. But they found that Tai Chi or Feldenkrais is their cup of tea. Pick what you're going to do, right? So and that's always my answer is, what should I do? Well, pick something you're going to do, because if you don't like boxing, you're not going to do it. You're going to be the couch potato guy. So find something you'll do, stick with it. Treat your exercise like you would your prescription, right? Well, I have to take my Cinemet 3 times a day, an hour before my meals. I have to exercise 30 minutes, at least 3 days a week. It has to be of moderate intensity. So that needs to be the focus if we're looking to live well with Parkinson's. And that's going to look different at different stages in the disease. Some people with advanced Parkinson's disease aren't going to be out running a marathon, but it doesn't mean you can't still exercise. You have to work within what you can do and continue to have that positive mental attitude and focus on your care. So my tips for living well with Parkinson's are not as many as the APDA, and tried to boil it down to cover most of those other things. So not 10, but 4. And so the summary, I think the 4 things, the first one is, again, believe you can. And that goes back. Remember, we talked about actual clinical trial evidence that believing in, whether it's the medicine you're taking or the exercise you're doing or whatever, believing that it's going to work will help it work better, and not believing that it's going to work will do the opposite. So that's the start. Before, if you don't, you have to start out with the positive mental attitude and believe. And then this is kind of a combination of some of the things they have there. So really have a team, right? So this has actually been a really important thing for me for our movement disorders center, our group. As a physician providing care for patients with Parkinson's disease, there's a lot of things that need to be covered, and there's a lot more than I can do in kind of an office visit. But I have a team of folks. You've met Casey already, and you're going to meet a lot of folks today that are going to talk that are part of our team. And if you go outside and you meet the folks through our resource center, we have a team, and everybody kind of has their part to play, and we try to overlap and help one another. And if you have Parkinson's disease, you need a team. And that's going to be your medical professionals. And our team, we're part of your team, but that's also going to be your loved ones or maybe other Parkinson's patients, right? So if you're in a group with Rock Steady Boxing, these are people that you're partnered with. These are your team. And when you need some help, they're there to help pick you up, and vice versa. So I think having a team of people that help you along the way is an important part. So believe that you can be better, have a team to help you achieve that. And I think additionally, we've talked about healthy diet, and there's really not a whole lot of data to support dietary specifics. We've looked trials at specific supplements, over time, and hopes that things that are antioxidants, coenzyme Q10 and turmeric and those sorts of things are hopeful, but thus far we don't have any clinical data to the point where I should say to a patient, you should go take high-dose thiamine or you should take turmeric. Most of those things are probably not harmful. Some of them are harmful to your pocketbook, but I just don't have any evidence of that. But we do know, and you'll get, again, if you kind of float around here today, there's evidence in just general brain health for eating a healthy diet. There's no real specifics to that. We'll talk about a Mediterranean diet and that sort of thing, but kind of like the exercise, we all know what a healthy diet is. We all know that, okay, I'm going to have McDonald's tonight is really not probably a good idea, but maybe I won't have it till next week. But we all know like what's good for us and what's not, and we know about moderation. So it's a matter, again, of a positive mental attitude and belief that, okay, this is important. I'm not going to be perfect all the time, but I'm going to try to change my lifestyle to improve my overall health. So some of those specifics in their 10 were laid out, but I think just in general, to boil it down to nice little McNuggets here, live a healthy lifestyle in general. And again, we all know what that means, right? We all know we should exercise. We all know we should eat healthy. We all know we should get enough sleep. And so having that defined in as far as the number of hours or the number of ounces of water and that sort of thing is kind of nitpicky, but we know what that is, right? We know a healthy lifestyle, and we know when we're not living it, we don't feel as good, right? So sometimes it's hard to get over that hump, right? You're stuck in that lull, being a mope, and it's really hard to get over that hill. And so that's where your team comes into play, and that's where having that positive mental attitude, because once you get over that hump, you feel better and you function better. And that's true whether you have Parkinson's disease or not, but I think it's especially true in Parkinson's disease. So live a healthy lifestyle, and again, capitalized here is exercise. Some kind of regular exercise. I generally recommend doing it every day, because if not, it becomes one of those things where it's like, well, I'll do 30 minutes 3 days a week. So Monday, but then Wednesday I've got an appointment, so I'll skip it. Maybe I'll do it Thursday, and then you don't do it Thursday, and then it's Friday, and now it's the weekend, and then you stop. So it has to be every single day. This is my prescription. I'm going to exercise. I'm going to stay healthy. I'm going to fight back against my Parkinson's disease. Eat healthy. Drinking plenty of water is in there separately, and I do think that's important in general, and specifically to Parkinson's disease, because a lot of the issues that we see may simply be related to, again, changes in blood pressure and that sort of thing that occur when you have Parkinson's disease. So just staying well hydrated can make you feel better. You won't feel dizzy and lightheaded when you change positions, and that can be a side effect of the medications. It can help you when you're exercising and you're sweating and you're losing that fluid. So it's really important. Drink plenty of water. I think sleep is really interesting. We know that sleep is tough sometimes in Parkinson's for a number of reasons anyway. And we know there's good evidence that even sleep when you're younger can affect things like they'll be talking about today in the dementia talks. So getting enough sleep, having appropriate sleep habits is really important. And I think also socialization is something there with the healthy lifestyle. And again, that kind of goes back to having a team. So if you have a team of people you can work with and socialize and stay, not just physically active, but mentally and socially active, right? You have to be out and doing things. And that's been really tough the last few years with the pandemic for our patients, kind of being isolated because they're at higher risk. And so hopefully now we're on the other end of that, and we've been able to kind of meet in person now and hopefully do so safely. And so kind of getting back out there, working on your health, working with a team, taking care of yourself, taking care of others. And then that goes on to the be involved. And so, be a player in your own health and your own care. Remember, this treatment starts with you. If you believe and you want to get better, seek those out, ask those questions, come to events like this, learn things about Parkinson's and what I can do. And don't get too caught up in is this related to my Parkinson's? Is that related to my Parkinson's? I'm going down that Google tunnel and I'm, that's my focus. Your focus should be on what can I do to be better, not is there a secret cure that I've missed that I can find on the dark web. If we had something that we had evidence was going to cure our patients, we'd give it to everybody. We're not withholding anything. This is what we have. This is what we know. So get out there, stay active, do things, plan. So know that you do have a degenerative disease and plan for your future. How can I be prepared for what's going to happen? How can I still accomplish the things I want to do? I've had some people get demoralized. So this is a word that I've seen a lot again that we've come up with as we talk about in the pandemic, demoralization, right? So it's not depression, but it's just kind of, you feel dejected. It's like, I planned all this for my retirement, but now I have Parkinson's disease and I can't do that. Well, that's not true. You can do it. You might have to figure out a more creative way how to do it. How to accomplish the things that I want to accomplish for my well-being despite this. Clinical trials are important. And again, that could be drug trials or just being involved. Contribute to the research. And that may help you. It may not come to fruition to help you, but it may help the community as well, right? It gives you some reason and some purpose. And so being involved in clinical trials or research probably has some inherent value, even if you're in the placebo arm. And remember, placebo effect is still a real effect, right? If you're feeling better and functioning better, who cares why it is? So that, support groups. And that can be for patients. And also remember that this is loved ones and caregivers too. So we have those resources. I encourage everybody to kind of mill around in between outside and check out our resource center. The things they have available. I think these are the things that can help us partner with patients to live well with Parkinson's besides just writing prescriptions. It's easy for me to write a prescription. It's relatively easy to take a pill, and these things work well. It's a little harder to have brain surgery, but it works well. But we often miss, the key ingredient in living well and doing well when you have Parkinson's disease is your involvement in your care when you're not in the exam room. It's not just the pill. It's living well. It's prevention of worsening. It's exercise. It's having this team and staying involved and working together. So like I said, this is really kind of an overture. They're going to get more meat for each of these things. I just wanted to kind of introduce the topic today. And on behalf of our entire movement disorders team, I thank you for coming today. I think, again, just being here, the people that make the decisions, the people that do well, the people that show up. So thanks for coming out today. I think we've got an exciting day and exciting things when we look at neurosciences and brain health, and in particularly in Parkinson's disease, as we look at prevention trials and treatment trials and these sorts of things. There's a lot of good things on the horizon, but don't forget, we've got a lot of good things now. We've got good treatments, both medical and surgical, and then the treatments that start with you. Thanks.